My name is Brian Cookson. I'm the chair of the Active Lancashire board. Active Lancashire is a partnership body, it's a not-for-profit company, and it's involved in trying to improve the quality of life of the people of Lancashire, but it's specifically targeting at the moment a number of programmes to try and improve the health and physical fitness levels of disadvantaged communities.
I'm Dr. Sakthi Karunanithi, Director of Public Health for Lancashire. I've always maintained close contact with the team, the Chief Exec, because we've got lots of shared priorities. If you look at the health challenges in Lancashire, there are a number of them, particularly the healthy life expectancy. There is a 10 years gap between deprived areas and less deprived areas. And particularly Active Lancashire plays a role in this, in being the bridge or the connection between NHS, local authorities, physical activity sector, as well as increasingly the economic sector. And helping our children get the best start in life is a key priority. We've inspired thousands of children to become physically active, and that sets the pulse and the rhythm for the rest of their life, but also maintaining our well-being, our physical well-being, our mental well-being and social well-being, and increasingly aging well. I'm increasingly finding Active Lancashire playing a key role in being able to bring some of these shared agendas together and continuing to listen to people and make a difference to some of the vulnerable cohorts in our communities. So I think the future is really bright for Active Lancashire. The final one, but is the most impactful one, is trying to raise awareness in the business sector about the importance of physical and mental health. And we know across Lancashire we lose approximately 1.4 billion pounds a year that's lost to our economy due to poor health at workplaces. The pandemic has clearly left indelible marks on our health and well-being, whether you're young or old, or physical health, or indeed the stress and the anxiety. Not only that, a lot of businesses have been affected, and we've got a long road to travel in recovering from the pandemic. The role of Active Lancashire is really welcome and very well placed in being the bridge between the business sector, the NHS and the rest of the wider public sector, and indeed the voluntary community and faith sector, in raising our health and well-being. We've got thousands of more people up and active. I think Active Lancashire has listened really well to the lives that people live, as well as the priorities of stakeholders, and tried to push the boundaries in bringing innovative practice by making connections with technology, for instance, and continuing to listen to people and make a difference to some of the vulnerable cohorts in our communities. So I think the future is really bright for Active Lancashire.